Today we're going to talk about the abdominal aorta and its branches. So here, this is the beginning of the abdominal aorta. It pierces the diaphragm at the level of T12, while the esophagus pierces the diaphragm at the level of T10. So these are important levels that we need to memorize. Okay, so the abdominal aorta begins at the level of T12. It has three main branches, and then these three main branches will supply different parts of the digestive and pelvic system. So the first branch, as we can see here, is the celiac branch. Okay, so here I highlighted the celiac trunk. As I said, there are three main branches of the aorta, right, that come out of the aorta from its interior surface, right? And there are other branches that are smaller than these three main trunks, which are the celiac, the superior mesenteric artery, and the inferior mesenteric artery, okay? The other smaller branches, right, we are going to mark them by the main trunks, okay? So the first one of these smaller branches are the inferior phrenic arteries. These two arteries that are just above the celiac artery. So we are going to mark them by being just above the celiac trunk, right? So we have the celiac trunk. Above the celiac trunk, we have two inferior phrenic arteries, and from its name, it supplies the inferior surface of the diaphragm, okay? Now, let's get into the celiac trunk. The celiac trunk bifurcates or trifurcates into three main branches. One of them on the left here is the left gastric artery. Then, the middle one right here, splenic artery. And then, the one on the right is the common hepatic artery. So we have three branches: left gastric, splenic, and then common hepatic artery, okay? First of all, let's trace the left gastric. So this is the left gastric artery right here, right? So the left gastric artery supplies the lesser curvature of the stomach, okay? So this is the left gastric artery. Then we have the splenic artery. So here, as we can see, I just highlighted the left gastric artery so it's more clear. And then here I highlighted the splenic artery, and it's very characteristic with its tortuous path, okay? Then as we can see, the splenic artery moves above the pancreas, okay? And it's also to be noted that the splenic vein will accompany the splenic artery, but it's going to be behind the pancreas. So the splenic artery is above the border of the pancreas, and then the splenic vein is behind the pancreas, right? The splenic artery right here gets into the spleen, and then it gives off one of its main branches, which is the left gastroepiploic artery, right here. This is the left gastroepiploic artery right here, the branches of the splenic artery, and supplies the greater curvature of the stomach. So until now, we have the left gastric, left gastroepiploic, and we're going to see later on where are the right gastric and right gastroepiploic are going to come from, which are going to anastomose with their congruent left branches. Also, of course, the splenic artery will give branches to the pancreas. Now let's get into the common hepatic artery. Okay, now to the common hepatic artery, okay? So the common hepatic artery will give 3 branches, right? So first branch of the celiac is the left gastric, no branches. Splenic gave 1 branch, which is the left gastroepiploic, right? Then the common hepatic, the third branch of the celiac, gives 3 branches. First branch is the, so here, this is the common hepatic, right? It will give off this branch, which is the this branch right here, this one, which is the right gastric, which anastomoses with the left gastric, right? And then it gives off this branch, which is the gastroduodenal branch. The gastroduodenal branch will give off, this gastroduodenal branch will give off this artery, which is the right gastroepiploic. So now we know where the right gastric comes from and the right gastroepiploic comes from, right? Now we have the full vasculature of the lesser curvature and the greater curvature of the stomach, right? And then the gastroduodenal will give another branch, which is called right here, this branch right here, which supplies, as you can see, the pancreas right here, this fatty organ, and the duodenum, right, which is called the superior pancreatico-duodenal branch, right? So the gastroduodenal will give something gastric, something duodenal, and then the duodenum, right, is in close relation to the pancreas, so it will give the pancreas as well. Okay, so again, the gastroduodenal will give me the right gastroepiploic, and then will give me another thing which is duodenal along with the pancreas because it's in close relation with the duodenum, so it will give me the superior pancreatico-duodenal artery. Okay, then to the last branch of the common hepatic, when the common hepatic gives off the gastroduodenal, which gives off 2 branches, and then the right gastric, and then it becomes the proper hepatic artery. Proper hepatic because it's just purely hepatic right now, right? It will give off the right and the left hepatic arteries, okay? The left and the right hepatic arteries, which will supply the left and right lobes of the liver, okay? Now, there is an interesting anatomical note regarding the hepatic artery along with the CBD and the portal vein. Wanted to give it a note right here. So this is the common hepatic artery, gives off the right gastric, gives off the gastroduodenal, and then becomes the proper hepatic artery. The proper hepatic artery is said to cross the portal vein anteriorly. So it crosses, this is the portal vein, it crosses anterior to the portal vein to enter the liver, okay? And then here is the CBD, right? So these 3 structures, right, are seen in the pelvic abdominal ultrasound, right, as a Mickey Mouse sign. So what is the Mickey Mouse sign? The head of Mickey Mouse is the portal vein, and then one ear of the Mickey Mouse sign is going to be the hepatic artery or the common hepatic artery, which is going to be on the left ear, and then the right ear is going to be the CBD, right? So it's just an important anatomical relation that I just wanted to note. Okay, so we finished the first trunk the first main branch of the aortic abdominal aorta, right? And we said in relation to the celiac trunk, which is the first main trunk of the aorta, is the inferior phrenic arteries, which are just above the celiac. So inferior phrenic arteries, and then the celiac trunk, the three branches of the celiac trunk. Each branch gives what branches? We're done with that. All right, let's get into the second main trunk. Okay, now we get to the superior mesenteric artery. I've hit a couple organs, the stomach and the liver, so we can see the superior mesenteric artery well, as well as its branches, okay? So the superior mesenteric artery is the second main trunk of the aorta, right? But between the celiac trunk and the superior mesenteric artery, we have three paired vessels, right, that originate from the aorta. First one is going to be the suprarenal artery. This one. The suprarenal arteries, right? They supply the adrenals on both sides. Then the renal arteries that supply the kidneys on both sides, and then the gonadal arteries. They run downwards right here that supply the testes or the ovaries, right, on each side as well. Okay, so these are the three paired visceral arteries that are between the celiac and the superior mesenteric artery. Now we have the superior mesenteric artery, right? Let's view the branches of the superior mesenteric artery. First of all, we said that the celiac artery gives off the common hepatic artery. The common hepatic artery gives off three branches. The right gastric with no branches of the right gastric, and then the common hepatic gives right and left, and then it gives the gastroduodenal. The gastroduodenal, we said it gives gastroepiploic, right gastroepiploic, and superior pancreaticoduodenal. So the first branch of the superior mesenteric artery is going to be the inferior pancreaticoduodenal artery, right? So right here, it gives off the superior pancreaticoduodenal artery, right here. So this is the superior mesenteric artery. It's also important to note that the superior mesenteric artery, the left renal artery that drains this kidney, the left kidney, runs between the superior mesenteric artery and the aorta, so it's behind the superior mesenteric artery. And if the angle between the superior mesenteric artery and the aorta is a little bit acute or small, it presses on the renal vein, the left renal vein, and it causes the nutcracker syndrome. So this is an important relation between the superior mesenteric artery and the left renal vein. Okay, so first it gives off right here the branch that goes upwards, right, to supply right here this branch that goes upwards to supply the pancreas and the duodenum, right? So pancreatic is supplied by the splenic artery, the superior pancreaticoduodenal, the inferior pancreaticoduodenal, okay? After the duodenum, we have the duodenum and the ileum. So we have duodenal branches and ileal branches, right? So right here we have several branches right here that supply the small intestine, right? After we finish the small intestine, so now it's supplied the duodenum, and then the duodenum, and then the ileum. After the ileum, we have the ileocecal junction, right? So it supplies the ileocecal junction by the terminal ileocolic. Terminal ileocolic, this is the terminal branch of the superior mesenteric artery. So as you can see here, it gives off the terminal ileocolic junction, right? or ileocolic artery, right? And then it supplies the right colic. It supplies the right ascending colon through the ascending colon through the right colic artery. So here, this is the superior mesenteric, right? It gives off here the ileocolic, right? Right here, this is the ileocolic, right here, terminal branch, and then here is the right colic artery, right? So here, right colic artery, ascending colon, right here, terminal branch is the ileocolic, right? Then it also gives branches, middle colic, right here. This is the middle colic. This supplies the transverse colon, or the 2/3 of the medial colon, right? 2/3 of the transverse colon to the middle colic, right? So these are the branches of the superior mesenteric artery. We can memorize them by just tracing the GIT. So it begins with pancreas and duodenum, then duodenal, ileal branches, terminal branch, which is ileocolic, going upwards, ascending colon through the right colic, and then transverse, or 2/3 of the transverse colon through the right, through the middle colic artery. And then we're gonna continue the supply of the GIT through the inferior mesenteric artery. Okay, so now we get to the inferior mesenteric artery. I faded the rest of the organs so we can see the inferior mesenteric artery and its branches clearly, okay? Now, let's continue with the digestive system. So we ended here at the 2/3 of the transverse colon, right? The left 1/3 of the transverse colon is supplied by the left colic, right? So here, the left colic artery, right? And then we have the left colic artery actually supplies the rest 1/3 of the transverse colon along with the descending colon, right? And then we have a sigmoid branch. The sigmoid branch will supply the sigmoid colon, and then we have a terminal branch right here. This terminal branch is called the superior rectal artery. So the terminal branch of the superior mesenteric artery was the ileocolic artery. The terminal branch of the inferior mesenteric artery is the superior rectal artery. So we have left colic, and then we have sigmoid, and then we have superior rectal artery, okay? Now, we said that before the celiac were inferior phrenic arteries, right? And that between the celiac and the superior mesenteric were 3 arteries, or 3 pairs of visceral arteries. 1 suprarenal, 2 renal, and 3 we have the gonadal arteries, right? And then superior mesenteric artery. The superior mesenteric artery originates from the aorta at the level of L1. And then the inferior mesenteric artery originates from the aorta at the level of L3, right? And then the aorta bifurcates into 2 common iliacs at the level of L4. So now we have L1, L3, and L4, right? So between L1 and L3, we have pairs of vessels, right, that are lumbar arteries, right, that supply the vertebra and the lumbar vertebra, okay? So these are the arteries that are between the superior mesenteric artery and the inferior mesenteric artery, right? And then at the end of the aorta, right, is a small, or at the bifurcation of the aorta in the two common iliacs, we have a small branch which is the median sacral. I don't know if I can view it here. Okay, here it is. This artery that falls down the midline from the bifurcation, and it originates from the posterior part of the aorta, right? The trunks, the three main trunks, they originate from the interior aspect of the aorta, except for the inferior mesenteric. It just goes a little bit to the left, originates a little bit to the from the left of the aorta. The paired vessels, they originate from the lateral sides of the aorta, and then the median sacral originates from the posterior side of the aorta, right? So basically this, we finished the abdominal aorta along with its branches. Last thing that I want to mention is the artery of Drummond. Okay, so the artery of Drummond is the horizontal line that connects between the right colic, middle colic, and left colic, right? Which creates a collateral circulation, so that if one of the major vessels, the right, middle, or left colic, gets ischemic or gets blocked, there are collateral circulation to the intestines, right? So this is the marginal artery, or the artery of Drummond. It connects the three arteries together. So that's it for this video, and thank you so much.